Hi everyone, I'm Dr. Rennie. I'm an NHS doctor, writer and broadcaster, and this is part 3 of my menopause series. So, whilst menopause appears to be a natural stage in ageing for all women, knowing this doesn't make it easier to handle if you're a woman who is suffering and in misery, and there are many of you I know. The other thing to know is that women in the UK have a life expectancy of around 83 years. Now, life expectancy 150 years ago was under 50, so before menopause for most women. Having said this, and to be fair, child mortality is often part of that, dragging the average down. And if we accept this, women still didn't very often live beyond 70. So whichever way you look at the data, women today are spending between 15 and 35 years extra living without oestrogen, which for many is miserable, and for some even makes them question the very point of living. So before we start picking apart the varied treatments, both natural and more medical, let's think about what HRT does to the body that you don't necessarily know is happening. I call these the hidden menopause symptoms because you don't know about them until they are a problem, often a big problem. So number 1 is bones. From around the age of 21, as depressing as it is, our bones start to thin. They lose bone density. Everyone is different, and this will happen at faster or slower rates. Where all women are the same is that at menopause, the speed of bone density loss accelerates dramatically. And if it's severe, osteoporosis is the result. There are, of course, things that increase our risk of reaching osteoporosis, and these include lifestyle factors, so smoking, heavy drinking, low physical activity, poor diet, family history. A family history of broken bones or osteoporosis is serious. Low body mass index, eating disorders, race, medications, long-term use of certain medications such as corticosteroids, proton pump inhibitors, anti-epileptic medications, medical conditions like rheumatoid arthritis, hyperthyroidism, hyperparathyroidism, celiac disease. At menopause, when estrogen levels drop to low or non-existent levels, bone density loss will be at its highest. This is exacerbated by the loss in progesterone and testosterone, which both contribute to a much lesser degree to bone protection. Long-term risks of osteoporosis are fractures, and these can kill and disable. A broken hip will result in death within 12 months for a third of women, and another third will never live independently again. Broken bones can cause long-term pain and disability. Number 2, cardiac risks. After menopause, a woman's risk of cardiovascular disease or heart disease significantly increases due to their decline in estrogen, which prior to menopause is protective from heart disease. Once you lose that estrogen, women start to see all of the heart-related risks that men see as they age. In fact, women mainly only suffer from heart disease after menopause. This leads to potential changes such as increased cholesterol, higher blood pressure, stiffer arteries, and this makes heart attacks and strokes more likely. Early menopause elevates this risk. So the younger you go through menopause, the greater the risk because there is more time for those changes to accumulate. To mitigate this increased cardiac risk, postmenopausal women should focus on healthy lifestyle habits, regular exercise, maintaining a healthy weight, don't smoke, manage blood pressure and cholesterol levels. Number 3, dementia. Some studies suggest that menopause may increase the risk of dementia, especially if the menopause is before 40. However, the relationship between menopause and dementia risk is complex, and studies have produced conflicting results. Having said this, women get dementia twice as often as men, and women have a much higher estrogen level than men. One study published in 2020 found that women who had their periods for a shorter length of time had a greater risk of developing dementia. A shorter reproductive span, for example, starting periods late or getting your menopause younger, suggests a shorter period of exposure to estrogen. Furthermore, another group of researchers found that women who had experienced menopause had reduced brain tissue and more amyloid beta proteins, which indicate Alzheimer's disease, in their brains than men and premenopausal women. We mustn't forget, however, that obesity, hypertension, diabetes, lack of physical activity, smoking, alcohol, isolation, hearing impairment and depression also contribute to the risk of dementia. And these are all things that we can modify and can control. So, having said all of this, you could be forgiven for thinking that menopause is overall not good for us. And generally, it really isn't. But let's not get depressed about it. It's inevitable. So my approach is this. We can't avoid it. So let's find ways, sorry, I've got a cold, to live with this as well as we can. And there are many ways to do this, from exercise, healthy living, a good nutritious diet, and from there on deciding on natural remedies for health and symptom control, plus or minus HRT and other medical interventions. So, don't miss my forthcoming video on all of these things. I will try and guide you through this labyrinth that is HRT. Do you know, guys, it sounds really, really complex and difficult. It isn't that complex and it isn't that difficult. For some it's easier than others, but there is always a path. You just have to find someone to walk it with you. Okay, take care. Bye.